Hello, my name is Touchton, and I'm going to inform you all about juvenile diabetes. Diabetes is one of the many diseases that kill every year. With a lack of care, death becomes another statistic, and life becomes part of the imagination. As Jim Ryan once said, motivation is what gets you started, and habit is what keeps you going. The quote that Jim gave is true for diabetics in the fact that when first diagnosed, motivation is the only thing keeping the medication and blood sugars on track, while later, habit is what keeps the person alive and moving. How diabetes occurs, symptoms, complications, cures, and tests are all things all juvenile diabetics should be aware of. Diabetes occurs when a virus enters the body and the immune system starts to produce antibodies that fight the infection. So pretty much, you get type 1 diabetes if it runs in your family, so if it's genetics, you are more than likely have a higher chance of getting type 1 diabetes. And what triggers it is when you get hit with a virus of some sort, whether it be you get the flu or whatever it is, hot temperatures, that normally triggers the start of the diabetes. So if the virus has some of the same antigens as the beta cells, then the T cells can actually turn against the beta cells, and that's what shuts down the pancreas. Type 2 is a little different. It doesn't necessarily have to be genetic for you to get it. You can get it from being overweight or have bad eating habits. You can also get it from environmental change as well, like you can for type 1. The next thing I'm going to talk about is hyperglycemia. Hyperglycemia is when the blood sugar is always high, so it's when the pancreas does not produce enough insulin, resulting in high blood sugars. So in this case, your pancreas would not work at all to try to reduce the sugars in your body. The next one is hypoglycemia. In hypoglycemia, the pancreas produces too much insulin, resulting in low blood sugars. So in this state, the person would normally not either take enough, they wouldn't hardly take any insulin, and they would eat more to keep their blood sugars up rather than taking insulin when they eat. The next thing I'll be talking about is symptoms. Watching for symptoms and taking actions on those symptoms can also be a factor in the patient's health. Whether it's longer in the term of when the symptom starts, that can affect whether they'll have complications later on or not. So it's really important that if you see symptoms of diabetes to get it checked out, even if you're not for sure if you have it or not. Some of the common symptoms include frequent urination, thirst, hunger, fatigue, and extreme weight loss. There's been researches done that say you can lose up to 16 pounds in a week if you have diabetes. So, you'll definitely know if you have an extreme weight loss, and you should definitely get that checked out by your physician. Though some of these symptoms seem somewhat normal in females, you need to try to keep a mind of what the symptoms are doing and how frequently they're occurring, and get that checked out as soon as possible. The next thing I'm going to talk about is medication. Since we don't have a cure right now for diabetes, medication is what keeps the blood sugars stable and helps limit the spikes and stuff like that. The most common type of medication for the nighttime dosage is Lantus. And what Lantus does is it just keeps you steady throughout the night, and it's a 24-hour insulin, so you won't go from 500 to 70, so it keeps you at a baseline rate. And then the next kind of insulin is Humalog or Novolog, and that is the short-acting insulin, so that's for when you eat, so that it takes care of those sugars right then and there, and you won't have to worry about the spikes later on. Along with diabetes comes a few complications. Those complications involve a stroke. That's just one of them. When you're diabetic, you're more than likely to have a stroke earlier on in the age than rather if you did not have diabetes. You can also have nerve damage, which could lead to foot ulcers. And with foot ulcers, if it gets to a certain extent, they will have to amputate the limb. Some other complications include blindness, sexual dysfunction, miscarriage, and stillbirths. Though these complications have some serious outcomes, the most serious of them all is a diabetic coma. In a diabetic coma, the person is alive, but it cannot be awakened, and they cannot see or hear, and those kind of things. It's just like a regular coma is just caused by diabetes. So that can be very serious, and if it's not taken care of right away, it can lead to death. Though there are no cures, they are looking for some cures, and they look through the biological side. So when they look through the biological side, they go in and see what caused it in the first place, and whether it was because you got the flu or high temperatures, like I said earlier. And then they try to do the opposite of that to maybe try to kickstart your pancreas. They also look at vaccines, and with the vaccines, they've actually had a couple successful trials so far, but they're waiting for the FDA to approve it, and so it can be distributed to all patients. And the vaccine is actually a arthritis vaccine, and for some reason it just kickstarts the pancreas and allows your beta cells to work properly. So that's really great, and a lot of diabetics are looking forward to that. Just kidding, sorry. All juvenile diabetes should be aware, they should all be aware of the cures, the medicine, the symptoms, as well as complications. Information such as that could be crucial to the survival of diabetics. Medication, procedure, and knowledge is all important to the life of a diabetic. Keeping a normal life for a diabetic may be more difficult than most people think due to the fact that high or low blood sugars could determine the outcome of the rest of their lives. Thank you.